Could you ever imagine this place would be termed a war zone? Well, this is how war zones looked like in 2020. This is a COVID-19 intensive care unit. The toughest cases of coronavirus are brought here for treatment. Before stepping inside the ICU, we were asked to wear all the necessary protective equipment. Although I wore the required PPE, part of me was still a little scared. Probably because there's still so much doctors do not know about the new virus. As I stepped inside, a nurse wrote my name on the jacket. This is how nurses identify themselves among each other. This is Dr. Başar Cander. He is the head of emergency unit at the Kanuni Sultan Süleyman Hospital.
The first one and the other one is towards the end of this corridor.
Dr. Cander is someone with a lot of experience in healthcare, but given the uncertainty revolving around the new coronavirus, even he is concerned.
We
have learned not to be afraid. We cannot see the entire picture and there is uncertainty. This leads to some certain concerns amongst doctors. We have some sort of fear mixed with anxiety because humans tend to be afraid of the unseen, just like this virus. Normally, if we can predict what a certain disease is likely to do, then we would be able to prevent that. But for the entire world, there is an uncertain process, as if we have a mathematical problem, and this creates some concerns.
Many patients have recovered in this ICU, but still some remain under treatment. This man is around 53 years old. He is one of the toughest cases of COVID-19.
Bu ağır Covid vakası, solunum yetmezliği var. Ağır Covid vakası, solunum yetmezliği var.
This patient has a severe case of COVID-19. He has acute respiratory insufficiency. Before intubation, we had monitored him, but the oxygen rate did not go up. And since there were no other comorbidity problems with the patient, we decided that he was fit for the ECMO device. And after this application, his levels came back to a normal level.
O yüzden ECMO'yu bir saat içinde bağlama imkanımız oldu. Şimdi ECMO'dan sonra toparladık kanları.
ECMO stands for extracorporeal membrane oxygenation. It is a highly advanced lungs and heart support system. Thanks to Turkey's strong healthcare, many hospitals in the country are equipped with this machine.
İki tane önemli damara, büyük damara, kasıktaki venleri.
What we do here is that for the two important veins in the thighs, we put two channels. One of them goes to the left side of the heart, and then we take from the left side and we pump it into the device. Through the device, we clean the blood by increasing the oxygen and decreasing the carbon dioxide. So what we do is replicate the function of the lungs, and then we pump the clean blood to the right-hand side of the heart. With the ECMO device, we take the blood from the body and we adjust the levels of oxygen and carbon dioxide, and we pump it back into the bloodstream. We can do that through an external artificial lung.
Kanı vücuttan alıyoruz. Oksijen ve karbondioksitini düzeltiyoruz. Tekrar vücuda veriyoruz.
Not everyone with severe coronavirus symptoms gets ECMO therapy. There is a certain criteria.
We do not apply this practice to each and every patient. There are certain criteria to meet if we are to use this method. You should note that the ECMO device is not a savior by itself. You could describe it as a good support for the treatment though.
The other patient in this ICU is another severe case of COVID-19. He is being treated with oxygen support.
Bu hastalarda oksijen düşük olduğu için normal oksijen yerine.
Well, these patients have low oxygen levels. We do not have to have them intubated right away. We do not want to apply the tube immediately. We have some other treatments we utilize before using these tubes. What we do is that we pump high oxygen. If we get a response from that, we continue with the oxygen. If not, then we use the respiratory device with a mask. And if we still cannot get a response, then we apply the tube. So there are 3 stages. This is the stage where we apply high oxygen.
Unlike other countries, ICUs in Turkey are not overcrowded. Dr. Cander says this indicates the virus is under control.
The system did not collapse here. So does that mean the peak of cases is coming down now?
Yes. Bu şimdi hastaların
Now this is an indication that the figures are decreasing and that the outbreak is under control. One of the biggest problems of this outbreak is that the beds are not enough and there is no ICU support in satisfactory numbers. Now you can see that we have space for intensive care. It means that we have taken the outbreak under control and not the other way around. So now the outbreak is slowing down.
Biz onun kontrolü altında değiliz.
I mean, it's quite sobering to be here, to be honest. So many desperate patients fighting for their lives. So many desperate patients fighting for their life. Like I mentioned, it's quite sobering to be here. Now, many nurses are present here, and these people, we see in wars, soldiers with their guns. This is perhaps the quietest war zone I've ever seen in my entire life. This is the quietest war zone. All you hear are sounds of ventilators, and these people are the real soldiers of the 21st century. Now, Doctor, I thank you once again for explaining everything to us, and thank you very much for doing what you are doing right now to save humanity and people. Many nurses are present here as well, like you see there and over there as well. We're going to speak to one of them. What's another name?
Damla.
Damla is one of the nurses working in the ICU. Since she's working in a high-risk place, she has not seen her family in 2 months.
No, I haven't seen any of them for the last 2 months. I only talk with them over the phone. I work for 24 hours and then just go home to sleep.
Just like any of us, she is also scared of contracting the virus. But helping humanity is more important to her.
Okay, I get tired as well. I am scared of this virus as well, but to be able to help someone get better and win against the virus makes me feel really good. I like this a lot.
When I asked Damla about nurses' mental health amid this pandemic, this is what she said.
Of course it is important. Our hospital provides the psychological support, like many other hospitals. We need some psychological support, as we all have been affected and scared of what has happened, but we need to stand strong for the people.
After spending an hour with these heroes, it was time to say goodbye. As I left the ICU, I thanked the medical staff and prayed for their safety. My colleague, ANEWS Managing Director Orhan Salih, also reassured the nurses that these days will pass. As they say, there is always light at the end of the tunnel.
Alright, now we're back from the ICU. Like I already mentioned, it was quite a sobering experience to see all these desperate patients and the nurses and doctors fighting to save the lives of COVID-19 patients. Now I'm going to take the PPEs off just to show you what doctors go through on a daily basis. I guess I have been wearing this for almost 1 hour or 1 hour and a half, and you can see how my glasses look, and I'm literally sweating. My whole body is sweating. So I'm going to take this off now. Now I'm going to take off my gloves because they're for sure contaminated. It just came out of an ICU. And the last process would be my mask. I've been wearing a lot of layers just out of abundance of precaution. I'm not sure if it really helps or not, but you never know. That's how human psyche works, I guess. So that's how my face looks now. I mean, it was a tough experience. Wearing it for an hour made me look like this. Now imagine doctors wear these PPEs for more than 12 hours every day. Some of them have not seen their daughters, sons, fathers, mothers, or any other family member.